Moving on to the muscles and blood vessels of the trunk, and these include the abdominal and back muscles, as well as the diaphragm and intercostal muscles which help us breathe. The trunk also contains all of the major arteries and veins which enter and exit the heart, as well as those that branch off to supply the lower limbs. So the anterior and lateral aspects of the trunk are made up of the abdominal wall, which is composed of skin, fascia, and 4 pairs of muscles: the external obliques, the internal obliques, the transverse or transversus abdominis, and the erectus abdominis. Now, if we begin to look at these muscles from superficial to deep, our first muscle is the external oblique. This muscle originates on the ribs 5 to 12 on either side and insert into the iliac crest, which is at the very top of your pelvis, and the linea alba, which is a band of connective tissue which runs down the front and center of your trunk. So it originates up in our ribs on this side and this side, connects down into our iliac crest on our pelvis, and then also into the linea alba, which is this connective tissue which runs down the center of the trunk. Now, when both external obliques contract, because we have one set that runs down this way, and then although it's been mostly removed on this side, we have one set that runs down this way, they cause trunk flexion, so like you're doing a forward fold. When they contract individually or one at a time, they will cause lateral flexion or opposite side rotation. So moving away from or to the opposite side of the contracting muscle. So when this side contracts, it will rotate the body to this side. The internal obliques then sit directly underneath the external obliques, and the muscle fibers of this muscle run in the opposite direction to our external obliques. So where the muscle fibers of the external obliques run from the ribs diagonally towards the pelvis, the muscle fibers of the internal obliques originate from the pelvis on the iliac crest and also the inguinal ligament. And the inguinal ligament is this ligament here that actually runs along the front of your pelvis. And then it inserts up into the cartilage of ribs 7 to 10. So we have our external oblique fibers running this way, and our internal oblique fibers then running this way. So you can see them around the cutout here. Like the external obliques, the internal obliques can work together to cause flexion of the trunk, or they can contract individually to cause lateral flexion or same side rotation. So same side rotation is where the body rotates towards or to the same side as the contracting muscle. So if this internal oblique contracts, we're rotating to this side of the body. Underneath our internal obliques is our transverse or our transversus abdominis. And this is the deepest of our abdominal muscles. And its muscle fibers run transversely around the abdominal wall, much like a belt would wrap around your waist. So you can see these muscle fibers running transversely along here. The transverse abdominis doesn't create a muscle action like all of the other muscles. Rather, it acts to compress the abdomen, working to support our internal organs, stabilize the spine and the pelvis when we move, and then also increase our intra-abdominal pressure when we forcefully exhale, so when you forcefully breathe out, or when you expel contents from either end, so whether that's vomiting or going to the toilet. Our final abdominal muscle is the rectus abdominis. This runs along the midline of the trunk on both sides. Rectus means straight, referring to the straight muscle. Abdominis refers to the abdominal region. Now, this muscle originates at the pubic crest and the pubic symphysis, which is where your two pubic bones will meet at the front. and then inserts up into the xiphoid process, or the very bottom of your sternum, and also the cartilage of ribs 5 to 7 on either side. When this muscle contracts and shortens, it will cause flexion of the trunk, so bending forward. And in a lean, muscular individual, this is the muscle that will cause that six-pack look. On the posterior side of the trunk, we find the quadratus lumborum and the erectus spinae muscles. The quadratus lumborum is a very deep muscle. So we actually view it from the anterior side if you've taken off all our abdominal muscles, because it is so deep. And it originates on the iliac crest, which is that top part of the pelvis. And it inserts into the inferior border of the bottom ribs, as well as the processes of the lumbar vertebra. Now, this muscle is named because it's rectangular, so it has 4 sides, hence quad. And it's also located in the lumbar region on each side. So we have a can't say quadratus today, quadratus lumborum on this side, and then also a quadratus lumborum on the other side. Now, when both of these muscles contract at the same time, they will shorten on the back, so they cause back or trunk extension. So like you're arching or you're stretching your back. If they contract individually, they'll provide lateral flexion, so bending over a bit like a teapot. We then have the erectus spinae group, and this is a group of muscles which form the prominent bulges that you can feel if you run your hands down either side of your vertebral column. So if you feel for your vertebral column on your back, the 2 bulges of muscle on either side are made up of our erectus spinae group. Now, this group of 9 muscles originate and insert in various locations along the posterior of the trunk, ranging from up near the occipital bone to our ribs to transverse processes of the vertebra, all the way down into our pelvis. When these muscles on either side of the vertebral column contract together, they also produce back or trunk extension. If only one side contracts, they will produce that lateral flexion. Now, the muscles of the trunk that assist in breathing are the diaphragm and then the internal and external intercostal muscles. These muscles change the volume of the thoracic cavity, which in turn changes the pressure within the lungs, causing either inhalation of air or exhalation of air. The diaphragm, which is this dome-shaped muscle here, and it does run all the way along, sits directly underneath our lungs, and it separates our thoracic and our abdominal cavities. Similar to the transverse abdominis, this muscle doesn't have a traditional muscle function, but it's our primary regulator of breathing. So when this muscle is at rest, it sits up like this in the dome shape, just underneath our lungs. When it contracts, it moves inferiorly and flattens out. And you can see how this will increase the space that we have in our thoracic cavity, which lowers the intra-abdominal pressure, and then air rushes down into our lungs. The intercostal muscles sit in between the ribs. So our external intercostal muscles sit superficially. And when they contract, they elevate the ribs, so bring them closer to one another to assist in inhalation or in breathing in. Our internal intercostal muscles sit deep to the external intercostal muscles, and they draw the ribs together, depressing the ribs or bringing them down. And we use these muscles during forced exhalation or forced breathing out. Moving on to the blood vessels of the trunk, and as I mentioned earlier, all of the major vessels that enter and exit the heart are found in the trunk region. And if we begin with our arteries, which remember carry blood away from the heart, and blood exits the left ventricle of the heart and moves into our aorta. The aorta is the largest artery in the body, and it's broken up into 3 different regions. So we have the ascending aorta, which is the section that exits the heart, if we imagine our heart would sit here, and it ascends, or it moves in superiorly. So it's just this little section here that is going upwards. The arch of the aorta, or the aortic arch, is where that artery begins to curve and then move inferiorly. So again, it's just a small section of this vessel, kind of about here. And then our descending aorta is all of the aorta which is going down or descending. So it extends all the way from here down to here. Now, the descending aorta can also be broken up into our thoracic and our abdominal aorta. However, for this unit, we refer to the whole section as just the descending aorta. The descending aorta then divides into a right and a left common iliac artery. This artery supplies the pelvic organs, our external genitalia, and then the lower limbs with blood. Our veins of the trunk, which carry blood back toward the heart, form a similar path to our arteries. We have the left and right common iliac veins, which drain blood from the pelvis, external genitalia, and the lower limbs. But then instead of the aorta, as it's going back up towards the heart, we have an inferior vena cava, which drains blood from the lower half of the body. And then a superior vena cava, so this section here, which drains blood from the upper half of the body. Both our superior and our inferior vena cava empty into our right atria.